Usually when we think about electricity, we just picture the wiring in our walls.
Right. It's a very closed, predictable system.
Exactly. You flip a switch, the light comes on. You flip it down, the light goes off. I mean, it's binary. Copper wire doesn't just suddenly, change its mind about how to conduct a current.
And honestly, that predictability is really comforting. We like engineered systems to behave exactly as they were designed to.
But then you step into the world of the human body's electrical system, right?
Yeah.
Our nervous system. We are not wired with copper. We're wired with wet, chemical, living tissue.
Yeah, and suddenly all that comforting predictability is just thrown right out the window.
It really is. Which brings us to today's deep dive. Based on the sources you provided, we are tackling a highly specific, honestly fascinating question. Can shooting a laser into your skin or getting a radio frequency treatment accidentally turn off your body's electrical grid and leave you numb?
It is a brilliant question. And it's something that fundamentally trips up a lot of people when they start researching these increasingly popular treatments.
Oh, for sure. And we are going to give you the spoiler right up front. Yes, they absolutely can.
Well, definitely can.
But the how and the why will take you on a really wild ride today. We're going to explore chronic pain treatments, how the body repairs its own electrical grid, and the booming, sometimes very controversial industry of vaginal rejuvenation. So, okay, let's unpack this.
To truly understand how these technologies can make a part of us go numb, we have to look at the exact biophysics of what happens when we shoot high-tech energy into human tissue.
Right.
Because it is not as simple as flipping a switch or just zapping a nerve.
Yeah, before we can even begin to understand how lasers and radio waves cause numbness, I feel like we need to establish a baseline, right? We need to understand how the body loses feeling in the first place.
Absolutely.
Like, if I get a cut, I feel pain. But how does a region of my body lose feeling entirely?
Well, we have to look at the anatomy of sensation. Our skin is innervated by this vast, incredibly complex network of sensory nerves. And they aren't all the same. Think of them as different types of data cables. You have unmyelinated fibers, which are essentially raw wires. They transmit that slow, throbbing, burning pain.
Oh, gotcha.
Then you have myelinated fibers, which actually have an insulated coating. And those transmit the sharp, immediate, highly localized ouch signals.
Right, that makes total sense evolutionarily. Like, you touch a hot stove, the fast insulated wires tell you to yank your hand away immediately.
Exactly.
And then the slower uninsulated wires give you that lingering ache so you remember to protect the burn while it heals.
That is exactly it. They're constantly transmitting touch, pain, and temperature data back to your brain. And numbness only occurs when those transmission lines are compromised.
Okay.
Medically speaking, the sources outline 3 main ways that compromise happens.
So I'm a visual learner, so I always like to visualize the nervous system like a garden hose.
I like that.
Yeah, so the physical nerve is the hose, and the sensory signal traveling to the brain is the water flowing through it. So if I'm thinking about how to stop the water, the first way is just the most obvious. You just hit the hose with a shovel. You physically cut it.
Precisely. Cutting or physical disruption. So small nerve endings, or even deeper, larger nerve branches, can literally be cut or disrupted during a surgical procedure with a scalpel. You sever the wire, the signal stops entirely.
Boom, numbness. Okay, the second way to stop the water in a hose is to put a hard kink in it, right? Like you fold it over or crush it.
Yeah, that's our second culprit, stretching or compression.
Right.
Nerves are resilient, but they really do not like being pulled taut.
Right.
During surgeries that involve extensively repositioning tissue, so think of a major facelift or a tummy tuck or even orthopedic joint surgeries, nerves can be stretched out or physically pinned down.
Ouch.
Yeah, and that physical kinking blocks the signal.
Okay, so if we aren't cutting the nerve with a scalpel and we aren't physically pulling or stretching it during a major surgery, what about swelling? Because whenever I get injured, whether it's a sprained ankle or a bad scrape, the whole area swells up. Does all that fluid end up crushing the hose from the outside?
You've just hit on the third, and for our purposes today, the most crucial culprit, post-procedure inflammation and swelling.
Okay.
After an injury or a medical procedure, the tissue becomes inflamed. It basically gorges with fluid and immune cells.
Right, the body's natural response.
Exactly. And this swelling exerts intense physical pressure on the nerves from all sides. It temporarily impairs their ability to function. It's like inflating a balloon inside a small box. Eventually, whatever else is in that box gets crushed.
That is a really great image. So let's apply this to energy-based devices, or EBDs, which
Yeah.
were highlighted in your sources.
Yes, let's do that.
Because when we talk about EBDs, we're talking about radio frequency wands, lasers, ultrasound machines. These are largely marketed as non-surgical.
Right, they don't use blades.
Exactly. They don't cut nerves like a surgical scalpel. Instead, they introduce pure heat. I mean, they rely on raw thermal energy.
Right. They use electromagnetic waves or focused light to literally heat up the water and the tissue inside your body.
But this is where I get hung up. Because if we aren't physically severing the nerve with a blade, why would heat cause it to go offline and go numb? Doesn't heat usually just cause pain?
That's a really good question.
Like we said earlier, if I touch a hot stove, my nerves absolutely scream at me. They don't just quietly go numb.
It's a fantastic point. Your immediate biological response to extreme heat is pain, and that's specifically designed to make you move away from the heat source.
Right.
But to understand why targeted heat can cause profound numbness instead, we actually need to pivot to a medical procedure where numbness is the exact deliberate goal.
Oh, interesting.
Yeah, we need to talk about radiofrequency ablation, or RFA.
The good numbness.
Exactly.
Mm.
RFA is a treatment used specifically for severe chronic pain. We're talking about debilitating conditions where the nerve is essentially malfunctioning, sending constant pain signals for no structural reason.
Like false alarms.
Exactly. Conditions like severe spinal arthritis, sacroiliac joint pain in the lower back, or trigeminal neuralgia.
Wait, trigeminal neuralgia, that's the one that causes the intense, like, electric shock type pain in the face, right?
Yeah.
I've heard it referred to as literally one of the most painful conditions a human being can experience.
Yes, it is absolutely excruciating. The trigeminal nerve constantly misfires. It makes simple things like chewing or even just feeling the wind on your face agonizing.
Wow.
So for patients suffering from this, turning that nerve off, causing localized numbness, is a life-changing goal.
So how does RFA actually work? Because we are talking about injecting heat directly into someone's body to stop a nerve from working. That sounds pretty intense.
It is, but it's a highly precise image-guided procedure. A doctor inserts a small, specialized hollow needle into the patient. And because they're working millimeter by millimeter near major structures, they guide this needle using continuous, real-time X-ray video.
Oh, wow.
Yeah, it's called fluoroscopy.
So they're literally watching the needle move inside the body on a monitor in real time?
Exactly. But before they do anything permanent, they perform what's called a diagnostic block.
Okay.
They inject a tiny bit of local, temporary anesthetic through the needle to ensure they have found the exact nerve branch causing the pain. If the patient's pain temporarily disappears, the doctor knows they are exactly on target.
Measure twice, cut once. Or I guess in this case, heat once.
Yeah, exactly. So once they confirm the target, an electrode is inserted down through that hollow needle right next to the nerve. It then sends high-frequency radio waves to heat the target tissue.
Sending a radiofrequency current right into the nerve itself.
Yes. And what's fascinating here is how they deliver that current completely changes the physiological outcome.
Really?
Yeah. If a doctor uses standard RF, the device creates a highly localized elliptical-shaped thermal lesion. It heats up to about 80 degrees Celsius, essentially cooking a tiny piece of the nerve about the size of a grain of rice.
Ouch.
But the heat literally destroys that microscopic area. It stops it from sending any signals to the brain whatsoever. Alternatively, they can use pulsed RS, which allows the heat to dissipate, modulating the nerve without creating that full thermal lesion.
So with standard RFA, we're essentially blowing a targeted fuse in the body's electrical panel to stop a false alarm. Like we are taking the wire out.
That is exactly what it is. And because you are blowing that fuse, a known, common, and desired side effect of RFA is temporary numbness, weakness, or a localized burning sensation right around the injection site.
But wait, if we are using concentrated heat to literally destroy the nerve tissue, like creating a thermal lesion that physically cooks the proteins, is that numbness permanent?
You would think so, right?
Yeah, because blowing a fuse implies it stays blown until an electrician puts a new one in.
You would naturally assume it's permanent. But this is where the body's electrical system proves how incredible it is. According to the sources, the human body can actually regrow its wiring. It is an astoundingly resilient grid.
Wait, it grows back.
It does. The pain relief and the localized numbness that comes with it usually lasts anywhere from 6 to 12 months.
Oh, wow.
For some lucky people, it might last a few years. But nerves regenerate very slowly, at a rate of about 1 millimeter a day. So eventually, the nerve repairs itself The fuse is rebuilt, and the pain might return, meaning the procedure has to be repeated.
Okay, so we've established that concentrated radiofrequency can cause temporary numbness on purpose. It is a highly calculated, image-guided strike.
Right.
But what happens when energy-based devices are used for broad tissue remodeling? Like a scenario where numbness is the absolute last thing you want.
This brings us to a massive, booming, and currently very scrutinized sector of medicine, the industry of vaginal EBDs.
Right. The sources mention an entire industry utilizing fractional CO2 lasers, erbium YAG lasers, and, temperature-controlled radiofrequency wands to treat things like genitourinary syndrome of menopause or GSM, as well as general vaginal laxity.
Yeah, and to understand why this industry just exploded, we have to look at how incredibly common GSM is. It affects about 50% of postmenopausal women.
That is a lot.
It is. As estrogen levels naturally decrease, it causes profound thinning, drying, and stiffness of the vaginal and vulvar tissues.
And it's not just a cosmetic issue. From what I understand in the reading, this drastically impacts quality of life.
Absolutely. The lack of elasticity and hydration leads to severe dyspareunia, which is chronically painful intercourse. It causes constant itching, micro-tearing, and even recurrent urinary tract issues.
Ugh, that sounds awful.
It is deeply uncomfortable. And for women who cannot or do not want to take hormone replacement therapy, the EBD industry stepped in and said, hey, we have a hormone-free solution.
Using lasers and radiofrequency.
Yes. The underlying goal of these treatments is controlled thermal injury. They're using these devices to heat the subepithelial tissue so the layers right beneath the surface.
Okay.
If the goal is simply a bit of tightening, the devices are calibrated to heat the tissue to about 40 to 45 degrees Celsius.
Okay, so 40 to 45 Celsius, that's about 104 to 113 degrees Fahrenheit. Hot, like a very intense hot tub, but, manageable. But what if they want to go further? What if they want to actually rebuild the tissue?
Well, if they want to trigger neocollagenesis, which is the biological process where the body deposits brand new, healthy collagen and elastin, they have to push the temperature up to around 60 to 67 degrees Celsius.
Wait, hold on. 67 degrees Celsius, that's over 150 degrees Fahrenheit.
It is.
That is hot enough to cause a severe third-degree burn on your skin in a matter of seconds. How are they doing that internally without just melting everything?
I know it sounds extreme, but that specific temperature threshold is biologically required.
Yeah.
At roughly 65 degrees Celsius, the triple helix structure of existing aged collagen physically unwinds. It denatures.
Okay.
Your body senses this acute thermal damage, panics, sends in cells called fibroblasts, and frantically builds new, tighter tissue to replace what was damaged.
Wow.
And to prevent burning the surface layer while hitting those deep temperatures, the devices are equipped with sophisticated cooling mechanisms, or they pulse the energy so fast it bypasses the surface entirely.
Here's where it gets really interesting, because the manufacturers often market these treatments as quick, painless rejuvenation procedures, right?
Right.
You read the glossy clinic brochures, and they describe it as a soothing, warm massage, in and out on your lunch break with zero downtime. But when you look at the FDA's Manufacturer and User Facility Device Experience Database, the MIUD database, the reality on the ground tells a completely different story.
A very different and very sobering story. Back in 2018, the FDA actually issued a public safety communication warning against using EBDs for vaginal rejuvenation.
Really?
Yeah, noting they had not established the safety and effectiveness for these specific indications. And when researchers dug into the MIUD database to look at the actual adverse events reported by real patients, the numbers were striking.
And these are reports of things going wrong.
Exactly. In one review of the database regarding these specific devices, out of 30 adverse event reports detailing potential complications, 11 of them specifically reported unexpected burning or numbness.
Over a third of the reports were about burning and numbness.
Yes. And another clinical subset identified 33 patients who reported severe chronic symptoms after these procedures. We are not talking about a couple days of tenderness here.
Right.
We're talking about long-term, profound numbness, severe internal scarring, and chronic dyspareunia, meaning the procedure intended to fix their painful intimacy actually made it permanently worse.
Was this just one faulty machine from one bad company, or?
No, and that's the concerning part.
Yeah.
Those 33 patients included 17 treated with fractional CO2 lasers, 12 with radiofrequency, 2 with hybrid lasers, and 1 with an erbium YAG laser.
Ooh, wow.
It spans the entire spectrum of EBD technology.
Okay, I have to push back here, or at least ask you to connect the dots for me. How does a procedure that is precisely calibrated to just heat collagen, to hydrate and tighten tissue, end up leaving a patient with profound long-term numbness?
It's a valid question.
If they're not aiming a needle directly at a nerve with an X-ray screen like they do in RFA, how is the nerve taking the hit?
If we connect this to the bigger picture, we have to loop back to the very first section of our discussion today. Remember our garden hose?
Right, the swelling.
Yes, we have to talk about inflammation. The thermal energy from these RF and laser devices is specifically designed to cause localized tissue inflammation.
Because neocollagenesis is fundamentally an inflammatory healing response. The body senses the intense heat, thinks it has been injured, and rushes fluid and repair cells into the area.
Exactly. But the margin for error is razor thin. If that 67-degree heat penetrates even a millimeter too deeply, or if the thermal relaxation time of the tissue is misjudged by the operator.
Wait, let me stop you there. Thermal relaxation time, what is that?
Think of a heavy cast iron pan on your stove. You turn on the burner for 10 seconds, the pan gets hot. You turn the burner off, but the pan doesn't instantly become cold.
No, it stays hot for a while.
Right. It takes minutes for that heat to naturally dissipate into the air. That cooling period is its thermal relaxation time.
Okay, so human tissue retains heat the same way.
Yes. Tissue needs a specific amount of time, usually measured in milliseconds, to naturally cool down after being hit with a pulse of laser or radiofrequency energy.
Got it.
If the clinician doesn't account for that and delivers another pulse of energy too quickly, the heat doesn't dissipate. It accumulates. It builds up far past 67 degrees. And that accumulation leads to profound, unintended, massive swelling in the surrounding tissues.
And we are back to the garden hose. The fluid crushes the hose.
We are. The inside of the space swells up. And in the pelvic region, the biological garden hose we are most concerned with is the pudendal nerve.
The pudendal nerve, that's the major nerve highway controlling sensation in that entire region, right?
Yes, it is a crucial nerve. It controls sensation and motor function in the genitals, the perineum, and the entire pelvic floor.
Yeah.
And biologically, the pudendal nerve is notoriously sensitive to compression. In fact, there is an entire medical condition called pudendal nerve entrapment, sometimes called cyclist syndrome.
Cyclist syndrome, because sitting on a narrow, hard bike seat for hours and hours physically compresses that exact nerve.
Precisely. People with this entrapment describe the symptoms as sharp, burning pain, sudden electric shocks, and profound numbness. Some patients describe it as feeling like they are constantly sitting on a golf ball.
That sounds miserable.
It is deeply, deeply debilitating. So, when an EBD creates too much thermal injury due to heat accumulation, the resulting massive swelling physically traps and crushes the local pudendal nerve branches. It suffocates them.
Wow.
It impairs their function, causing the numbness, the tingling, and the chronic pain those patients reported to the FDA.
So, what does this all mean? It sounds to me like these energy-based devices are the ultimate double-edged sword. I mean, the exact mechanism that triggers a healing, tightening response, which is raw heat, is the exact same mechanism that can trigger localized swelling, severe nerve compression, or even direct thermal damage if the temperature goes just a few degrees too high or a few millimeters too deep.
That is the absolute crux of the issue. When you are dealing with thermal energy in the human body, the margin for error between stimulating collagen for a cosmetic benefit and suffocating a major sensory nerve with inflammation is incredibly small.
Okay, let's summarize this deep dive for you, our listener. We started with a mission to answer a very specific question from the source material, whether radiofrequency and lasers can cause temporary numbness. And the answer is absolutely yes.
Unquestionably, yes.
In medical procedures like radiofrequency ablation for chronic pain, it is a highly calculated, image-guided strike. A doctor is deliberately blowing a fuse, taking a misfiring nerve offline for 6 to 12 months to bring someone desperate relief.
But in the world of aesthetic or gynecological EVDs, that same numbness can be a highly distressing, completely unintended consequence. It is the result of excess heat causing out-of-control inflammation, which in turn physically compresses the highly sensitive nerves in the pelvic floor.
And this is exactly why a deep dive like this matters. Because whether you are a patient looking into chronic pain management, or you are considering an aesthetic or rejuvenation treatment, you are introducing raw, powerful thermal energy into a highly sensitive electrical grid.
You really are.
Understanding the biophysics, knowing that a laser isn't just a magic wand waving over your skin, but a tool that creates controlled thermal injury, helps you make informed, empowered medical decisions. You have to respect the body's electrical system.
Speaking of respecting the body's electrical system, I want to leave you with one final mind-expanding thought on where this is all heading.
Okay, lay it on me.
Right now, as we've discussed, we rely on what is essentially clumsy bulk heating.
Right.
We push a hot radiofrequency needle into tissue, or we blast a surface area with a fractional laser and just hope the heat dissipates correctly.
Right.
But the emerging research points to a completely new frontier called magnetothermal stimulation.
Magnetothermal stimulation. I love the sound of that, but it sounds like something straight out of a sci-fi novel.
It really does, but it is very real and actively being researched. Scientists are developing functionalized microscopic magnetic nanoparticles.
Okay.
These are tiny, tiny particles that can be delivered to specific targeted neural regions deep within the brain or the body. Then, instead of applying direct, clumsy heat from a wand or a laser, doctors apply an alternating magnetic field from the outside of the body.
So the magnetic field passes harmlessly through the tissue, but it heats up those specific microscopic particles, like tiny little space heaters attached directly to individual cells.
Exactly. The magnetic field causes just those specific nanoparticles to vibrate and warm up. And here is the truly incredible part. This localized microscopic heat can actually trick the specific targeted ion channels, the tiny molecular gates on the nerve cell membrane, into opening or closing.
Wait, so instead of burning an entire elliptical lesion into a nerve or accidentally inflaming a whole region of tissue, they are just warming up individual microscopic gates on a single nerve cell to modulate its activity.
Precisely. It achieves highly targeted neuromodulation without affecting the surrounding tissues at all. It completely removes the risk of that profound bulk heating inflammation we were just talking about.
That is wild.
When you look at this emerging technology, it raises a fascinating question. Will we soon look back at today's lasers and radiofrequency devices as the clinical equivalent of using a sledgehammer to press a doorbell?
Using a sledgehammer to press a doorbell, that is an absolutely incredible image to end on. We've gone from the static wiring of a house to garden hoses getting crushed by fluid to taking a sledgehammer to a doorbell, all to map out exactly how the body's electrical grid reacts to heat. It is a wild, sometimes muddy diagnostic landscape, but hopefully it's a little clearer for you now. Keep asking brilliant questions, keep investigating the biophysics behind the glossy marketing, and join us next time for another deep dive.